Seems to be a growing interest in nutraceuticals, as we're talking about here, alternative medicine, and just maybe just people seeming to take more of an ownership in their own health treatment plans. What's your opinion on that? Why is that growing so much right now?
Well, they do, and the thing is, back when I first started out in medicine, when you wanted to do research, you'd go to the library and then you would ask the librarian to print off, different articles for you based on this subject, and you'd get this printout from the old computer paper that would list all the articles, and then you'd go find them. I mean, that was me trying to find things. Your average person out there couldn't even do that. Now, information is available for everybody. I mean, you can just go on the online, and like I mentioned once before, Dr. Google. You can find almost anything you want. And there's actually, speaking of that, Google has a specific website that has just scientific articles, and it takes out all the advertising. It's called Google Scholar. Okay, you just pop that in, and it's just straight articles. So if you want to get away from the advertising or look for like websites, people that are trying to sell you things, you go to Google Scholar specifically. So I think that people are more educated now because they can be. They have a source to be able to find this information out where 10, 20 years maybe they didn't.
Right.
Yeah, and that's I think that's why we're seeing all these new terms and stuff too for different treatments, like the mashup of nutrient and pharmaceutical is now nutraceutical.
Sure.
So I myself, I'm an older millennial generation, but I love technology. That's why I work in it. But like with technology, are you seeing more people coming in better educated now and knowing what they're looking for?
Oh, absolutely.
Rather than, before go to the doctor and just do exactly what he says.
Yeah. So for me, that's even easier sometimes. Someone comes in, they know exactly what they want. As long as it's not something crazy where it's gonna hurt them, I'm like, okay, this is good. We'll do this. And a lot of times when that happens, a patient is relieved, because they, either they know or they've tried going to see their doctor, and it's like pulling teeth. It's like, no, I don't believe in that. We're not going to do that. This is the way we do things. And that's you can't necessarily fault that physician for that, because that's the way, that's their practice. That's the way they do things.